the biggest reason people come to us is another provider has told them, hey, we need to do a joint replacement on your knee. Well, a lot of people don't want to have surgeries. So what they do is they come to us and go, hey, I've been told I need to have a joint replacement. I've heard that you guys have this stuff called stem cells and PRP. So we talk to them about how their arthritis, yes, it is deteriorating their cartilage, but what we can do is we use stem cells and PRP from their own body.
Welcome to Business Ninjas, brought to you by WriteForMe, where you'll hear from business leaders who are out there growing their business and slaying it every day. Learn from the masters. Let's get started.
Hey everybody, welcome back for another episode of Business Ninjas. I'm here today with Garret Ewers. He's the CEO at Rejuv Medical and Rejuv MedFit. Garret, welcome to the show.
Well, thank you for having me.
Yeah, excited to have you. So Garret, why don't you start and tell us a little bit about yourself?
Sure. I've kind of got a varied careers over the years. I've been everything from a bartender to a carny and everything in between. And I came to Rejuv Medical about 10 to 11 years ago. Actually came here as a fitness manager to help them out to run their gym side and weight loss programs and personal trainers and stuff like that. And over the years, I've kind of bounced up and down through my roles and locations with Rejuv Medical, and I was able to outlast everybody else and take over the CEO role about a year ago. And that came from just, like I said, my varied background in all the different industries that I've been in has allowed me a greater understanding of how business works and how we can achieve our goals that we want to achieve at Rejuv Medical.
That's fantastic. And, before we dive into a little bit about the growth that you've seen over the last 10 years, tell me a little bit let's tackle Rejuv Medical first and then Rejuv MedFit. So tell me a little bit about Rejuv Medical.
Rejuv Medical really started out as just a non-surgical or orthopedic clinic. And the doctor, after working with his patients, really realized that weight loss really would have helped them so much more achieve their goals of getting pain-free. So he brought in a personal trainer about 6 months into having his first clinic, and everything really started to boom from that. And then they started to go, okay, what else can we put on? They started looking at functional medicine. Okay, how can we adjust our hormone levels to be able to achieve better weight loss, better pain reduction, and those types of things. So he started to step back and look at his vision of what he wanted Rejuv Medical to be, and really realized that it needed to be more of an integrated medical facility. So now what Rejuv Medical is it's really based off 3 different pillars. It would be non-surgical orthopedics, where we specialize also in regenerative medicine, so stem cells, PRP, and stuff like that to help people kind of regenerate their joints and their ligaments and tendons and stuff like that to stay away from surgery. Then we have functional medicine, like I said before, really optimizing the hormone levels to allow people to sleep better, deal with stress better, help with weight loss, those types of things. And then we have medical fitness, where we integrate fitness into the medical facility. So really helping people to move better, really pair that with stuff like physical therapy and supplementation to gain better results and have those results actually last longer.
Wow. So, over the past 10 years, it sounds like you've seen a lot of growth, with the incorporation of fitness, it sounded like, and, you stepping into the CEO role. Talk to me a little bit more about the growth that you've seen specifically with Rejuv Medical.
The growth really has come from people realizing that there's a different way healthcare can be accomplished. We used to be looked at in the early days as almost like voodoo medicine for a little while. But then as the community started to give us a chance, they started to realize that, wow, we can be so much better. And I don't have to be reliant on all this medication that I'm taking. I don't have to have surgery on my joints. And we went from 1,200 square feet in our first facility, 5 years later, having 24,000 square feet. Now we have, I think, 28,000 square feet facility. another location about 70 miles from here, and we're looking to actually increase the footprint of that one because so many people are starting to look at this way of a healthcare model and realize that they can actually partner with their healthcare provider, understand what's happening to their body, and it just makes sense to them now.
Yeah, absolutely. And, I think that that's like you said, a shift that has happened. And, I'm thankful that Rejuv Medical has really been able to benefit from that. Talk to me a little bit about Rejuv MedFit.
Sure. So about 5 years in, when we went from our 12,000 square feet to our 24,000 square foot building, a lot of practitioners started to ask us, hey, how are you guys growing this fast? So we started to give them information. They also wanted to learn how are you guys getting the results that you're getting on the PRP and stem cells, that regenerative medicine. So after we started helping a couple of people out, we decided to form a second company, and that was Rejuv MedFit. And now what we do is we hold 4 seminars a year on regenerative injection techniques and practice success. We have a mastermind program where we have worked with 90 clinics around the world, most of the continental United States, but about 10% of them are outside the United States, because they've looked at our model and they're like, how can you guys help us replicate what you're doing and help us achieve the results in your patients that you guys are achieving? So we've been doing this now for about 10 years. Probably ran through about 1,200 practitioners that have taken our courses and our teachings. And like I said, about 90 clinics throughout the world.
Wow, that's fantastic. So, you mentioned before kind of 3 different pillars, and I want to make sure I heard them right. So it's the non-surgical solutions, the functional medicine, and then that regenerative medicine. Can we get a little bit more specific and talk to me a little bit about, you mentioned like the stem cell regenerative medicine kind of under that non-surgical solution, I imagine. Talk to me a little bit more about the different treatments that Rejuv Medical offers.
Sure. So with regenerative medicine, we're taking a look at all of your joints. So your knees, your shoulders, your pelvis, your spine, all of that. But we're also looking at the ligaments and tendons that you have. So, the biggest reason people come to us is another provider has told them, hey, we need to do a joint replacement on your knee. Well, a lot of people don't want to have surgeries. So what they do is they come to us and go, hey, I've been told I need to have a joint replacement. I've heard that you guys have this stuff called stem cells and PRP. So we talk to them about how their arthritis, yes, it is deteriorating their cartilage, but what we can do is we use stem cells and PRP from their own body. So PRP is just a fancy way of saying platelet-rich plasma, and that's really the healing cells of your body. Naturally, your blood flows through, tries to heal, but it just doesn't have enough of those blood platelets. So what we'll do is we'll do a normal blood draw, just like you're donating blood at the Red Cross or something like that.
Mm-hmm.
And we'll take that blood, we'll spin it down and take all the healthy platelets and get super concentrated and then inject that into the area of pain or degeneration of that knee to help it actually regenerate a little bit, get that cartilage back, create that cushion back. Or what we can do is we can look at all the tendons. And over time, what your tendons will do is they will start to fray, just like you look at old ropes and it's no longer smooth. It's got all the frays on the sides and stuff like that. Well, PRP or stem cells can actually bathe that tendon and actually tighten it back up and make it nice and smooth again. So we're really turning back the clock a little bit and helping people get rid of pain, but also regain the mobility back again. So those that want to spend more time playing in the playground with their grandchildren, or if they want to be an athlete for longer and help maintain their body, regenerative medicine is something that they're really starting to take a hold of, and it's being very common practice now.
And, when you're talking about that, the regenerative treatments and, solutions, sorry, I imagine kind of when you just said grandchildren as well, your client base tends to be maybe a little bit of like an aging population, or do you tend to see it run the whole gamut?
We really do run the whole gamut. Most people are going to be 40 or years of age or more, partially because one, their body is wearing down more at that point. They also have the financial aspect that to afford some of these higher end services like that. But we work on high school athletes, we work on Olympic athletes, everyday weekend warriors. We have a lot of CrossFit people that come to us because that's a sport that really can wear on your body. So if they want to do it longer, they want to be better, they're doing these regenerative medicine techniques to be able to do their sports longer.
Interesting. That's fascinating. And, I imagine too, not only are you helping individuals, within the community with the growth, but I also think it's fantastic that, you're helping businesses as well, in the area.
Thank you very much. And
Yeah.
yeah, it's very rewarding both on with our patients as well as all the different businesses that we've been able to help. Especially, we helped a lot of businesses just find ways to stay open during COVID and not have to close their doors. And now they're back to thriving.
Mhm. I imagine, pivoting a little bit, Garret, I imagine a lot of the work that, Rejuv Medical does is working to build that education, and also, behind some of the treatment options and build trust as well. Am I right in thinking that?
Yeah, I've really put a lot of stress to all of our employees that we have to earn the trust of all of our patients. And that comes from our marketing, kind of pulls them in, but then we have to educate everybody on who we are, why we do what we do, and really look at everything as building a relationship with every patient that comes through the door so they can know, like, and trust us. And I think that's crucial for any business at this point.
Hmm. Yeah, that's interesting. And you mentioned before, Garret, that Rejuv Medical has seen extreme growth in the last few years, has really taken off since you guys got the larger square footage. Any plans for the future for further growth?
Actually, yeah, there is. We are going to be looking at expanding our footprint over this next year. I'm doing a proof of concept. So we are working with a couple clinics that have been part of our mastermind program for a little while, and they're looking to become Rejuv Medicals now. And then we are actually looking to do a couple more locations, probably in Minnesota. Um, so we can have about 5 more locations by this time next year. If those are all going well, my plan is to do about 5 to 6 locations each year for the next 8 to 10 years.
Wow, that's fantastic. I'm looking forward to following the growth of Rejuv Medical. That's fantastic. So as we start to wrap up this conversation, Garret, is there anything that you want to leave our listeners with, whether it be advice, anything like that?
Sure. What I really encourage everybody, especially looking at healthcare and looking at all the marketing that's out there, really do your due diligence and find out who your providers are. Ask them the important questions and realize that medicine and healthcare right now is at an inflection point to where it's trying to go 2 different ways. We are trying to go more towards the way of regenerative and holistic and functional type of medicine, to where we really put medicine back into the hands of the patient. And the other route would be what the typical healthcare model is right now, where it's more medication, surgeries, and things like that. So there are lots of options. You just have to put a little bit of time and effort to see what options are available to you.
Well, fantastic, Garret. This has been a very insightful, terrific conversation. I enjoyed hearing all about the growth you've had thus far and the growth for the future. I'm looking forward to following, the continuous growth. And I really appreciate you being on Business Ninjas today.
All right. Well, thank you very much for having me as a part of this, and it was very fun.
Yeah, great to have you.